Several reported resignations by physicians has raised concerns in the public domain. A letter issued in July by the SLMDA president has sparked public debate on the state of healthcare and the ill treatment which medical practitioners face. The Minister for Health clears the air on the matter.
We have seen at our various health facilities, professionals leaving. We have seen nurses leaving, going to other countries. We've seen professionals leaving. And therefore, when we see in whether it be the St. Jude Hospital, the OKEU, the Soufriere Hospital, the Crozile Polyclinic, from time to time, we have professionals who leave. And we try our very best to cause new professionals to come in. We know that in the health sector in general, we are working to see what we can do to encourage professionals to remain.
He says discussions with key stakeholders are ongoing to address the multitude of issues in the health sector. The health minister assures citizens that these issues will be addressed immediately as their well-being remains a top priority.
There are issues, there are problems, and those problems, many of those problems, have been there for many, many years. When we came into office in 2021, we pledged that we are going to do what we have to do to fix the problems in the healthcare system. Some of those problems, we have worked on many of the issues in terms of equipment, causing the subvention to both the St. Jude Hospital and the Millennium Heights Medical Complex, where the Owen King EU Hospital is located. We have increased the subventions. We have caused many new pieces of equipment to go into these health facilities, and we continue to work with the health professionals.
Mr. Jean-Baptiste highlighted the efforts which the ministry has made in partnership with the government to ensure that health facilities around the island are up to standard in an effort to prevent staff resignations.
I met with both the administrators and members of the board of both the OKEU Hospital, Millennium Heights Medical Complex, and the St. Jude Hospital. They raised a number of concerns in terms of certain resources, additional resources that they needed, resources in addition to what's in the budget. And the Prime Minister promised to give them those resources. After that, there's been some additional concerns, and the government has responded with $11 million out of the CIP funds to ensure that the OKEU Hospital deals with its payables.
He honed in on the debt left by the former administration, which must be addressed. The health minister says that work will continue to revamp the whole health sector to ensure citizens receive affordable and high-quality health care.
We are looking at the whole health system, and there are payables of up to between $44 and $50 million owed to various medical facilities, owed to suppliers, both locally, regionally, internationally. Some of them from as far back as 2001. And what this government is doing, we are working with the suppliers, working with all of those institutions to ensure that we pay.
The health minister says St. Lucia's foreign ally, the University Hospital of Martinique, will be paid off their debts soon. He says that work will continue to smooth out issues in the health sector so that more attention can be focused on the completion of the St. Jude Hospital, as it is long overdue for completion. For the DBS Newsworld, Manasseh Stanislas reporting.